Also welcome Dr. Daniel Borreson. He is the Surgical Director of Adult Renal Transplant at Mercy Health, St. Mary's, and the Surgical Director of Pediatric Renal Transplant at the Helen DeVos Childrens Hospital. Dr. Borreson, kidney is one of the few organs that can be donated from a living donor. So can you tell us what it's like and what it takes to be a kidney donor?
I'm told there are about 300 people here tonight, so just stick around for a second. The St. Mary's, Mercy Health St. Mary's has 330 people on their list looking for a kidney. And there's 3 children at DeVos Childrens Hospital. So it's like everybody here plus about 30. I'm going to answer the question in 3 parts. 1, deceased donors from people who died. And who can do that? Well, basically everybody can sign up to be an organ or tissue donor. So it's not just organs. Think you're too sick, you're too old. You may not be able to use your kidney or your heart, but there's probably something. And that can be done through the Secretary of State, online, and there's resources to help you with that. The other thing is to let your family know that that's what you want, because we get a little bit of a predicament when they have designated themselves to be a donor and their family's going, well, we're not sure we want to do this, so make sure you communicate that with your family. About 55% of the kidneys that we transplant come from deceased donors, and about 45% from life. So what does it take to be a live donor? I'm going to answer this in 2 parts. 1, medically, physically, we're looking for healthy people. We first want to do no harm. So if you have high blood pressure, diabetes, other illnesses that could claim your kidney function down the road, we really shy away from that because we don't want to add to the list of people who are looking for a transplant. And so there's a lot of testing to be done. Any of you who have given a kidney or been a live donor know that there are a lot of hoops to jump through, but it's for your own good. I should also tell you, though, after going through those hoops, the chance of a person who gives a kidney developing kidney failure is actually less than the average population. But we've weeded out the people with high blood pressure, with diabetes. So if you've given a kidney, your chance of actually developing kidney failure is very, very, very good. The second part of this is more spiritually or emotionally. And I am always amazed at donors. These people lay down on the operating table and give up a perfectly good organ. And doing that operation actually does them absolutely no good. They don't come out of the operation medically better for having given up a kidney. But in my experience, most of these donors are far more concerned about how did the recipient, how are they care more about their fellow patient than they do for themselves. They're amazing people. So if any of you want to be an amazing person, think about it. They are amazing people. We do, there are ways of donating when people don't match blood type and tissue type through paired exchanges and chain donations, which is kind of a bureaucratic red tape, a lot of bureaucratic red tape, which I don't understand. But if you're interested in donation, there are altruistic donors, which are people that just say, you know, I'm in good shape, I want it good, and we do entertain, look into those situations. So that's what it takes to be a kidney donor.
Very good.